Welcome to Basic HIPAA Training. I'm John Tomes, an attorney, consultant, and author who is specialized for actually well over a decade in complying with the important Federal Health Insurance Portability and Accountability Act of 1996, commonly known as HIPAA. What we're going to do today in this training is we're going to cover what HIPAA is, what the HITECH Act is, and what does it have to do with HIPAA. We're going to talk about HIPAA's criminal penalties, HIPAA's civil penalties, and then we're going to talk about that HIPAA isn't the only thing you have to be concerned about. Other particularly sensitive information, such as mental health, substance abuse, or AIDS information, may have even more legal protection than HIPAA affords. And then we're going to make sure you know how you can avoid these very severe HIPAA criminal and civil penalties. And then we'll have a conclusion and question and answer session. What is HIPAA? Well, it is a federal law. It stands for the Health Insurance Portability and Accountability Act of 1996. You may be wondering, well, what does HIPAA, a federal law, have to do with me? Maybe you're in a private hospital, a long-term care facility, a physician practice in some state. But HIPAA requires your healthcare business to protect medical information. You work for a healthcare business, so the federal HIPAA law requires you, as well as everyone else in the organization, to protect this very sensitive information. Now, HIPAA talks about health information with all sorts of terms. What does it mean by a medical record? Well, sometimes HIPAA calls it individually identifiable health information. And individually identifiable health information is nothing more than a medical record or other data that you could look at and figure out who the patient is. HIPAA has a lot of examples of what makes health information identifiable. Things like their name, their social security number, their address, Medicare number, a private insurance number, and so forth. Sometimes HIPAA calls it protected health information, or PHI. Protected health information, PHI, is individually identifiable health information maintained or transmitted by a health plan, an insurance company, a healthcare provider, a healthcare clearinghouse, or a Medicare prescription drug sponsor. A clearinghouse is nothing more than a business that receives electronic health information in one format, performs a value-added service such as reformatting it into another format so that the ultimate recipient that they forward it on to can work with the data. So these four different types of entities are called covered entities because they're covered by HIPAA and they have to comply with it. But PHI is far more than just the medical record. It also includes financial, demographic, and lifestyle information. And it can be paper, it can be electronic, and it can be oral, or if technology comes up with some new form or format, that would still be able to contain or transmit PHI. Well, what does protect medical information mean? HIPAA requires you to protect the integrity, confidentiality, and availability of medical information. Integrity is really a simple concept. It means the data is there when you need it and it's accurate. I think it has really four components. One, it's in the medical record or other file when you need it. Two, all of the information that's supposed to be in the medical record or other file is in it. Three, nothing that's not supposed to be in the medical record or other file is there, like a misfiled lab that would belong to another patient and should be in a different medical record. And then finally, that you can find the medical record when you need it. Well, what's the confidentiality aspect? Confidentiality of the medical record means that the medical record, just sometimes called the clinical record, and it may be paper or electronic, called all sorts of things, an electronic health record, the EHR, an electronic medical record, EMR. But anyway, all that data is supposed to be secret. Doctors and nurses and other practitioners, patient accounts managers and the like, and other staff people like you may be, are not supposed to blab about their patients' or clients' medical conditions or show what's in the chart to anyone who has no business knowing what that data says, knowing what's in the medical record. So what does protected have to do with it? Congress meant for HIPAA to protect health information, and thus HIPAA requires you to protect health information and the business that you work for. Well, what happens if you fail to protect this health information? If you allow a breach of confidentiality or of data integrity? Well, monetary fines, confinement, and other bad and painful things can result that we really don't want to happen to you. So what kind of jail time are we talking about? What kind of fines do you face if you violate HIPAA's criminal law? Well, if you simply get or give out medical information that you're not supposed to access or you're not supposed to disclose, you could go to prison for a year and have to pay a $50,000 fine. In other words, you'd get to be my neighbor, because I live 35 miles southeast of Leavenworth, the big house. I've been there, and you don't want to go there. Now, if you use false pretenses to get that access, you say that you're from the health department when you're not, then the fine goes up to $100,000, and the length of confinement you would face goes up to 5 years. So if you lie to get access to the data, really ups the penalty. And then we have what I call the biggie. If you access the data or you disclose it for personal gain, to make money, like to commit identity theft, for malicious harm, to embarrass somebody by leaking it that they've got AIDS, sounds like malicious harm to me, or commercial advantage, you want to use this data to market one of your products, then the maximum penalty goes up to $250,000, $250,000, and up to 10 years imprisonment. Now, I don't know about you, but 10 years of federal prison would get my attention as something that I would like to avoid. Now, the Congress passed this big stimulus package back in February of '09. And in this stimulus package, they crammed some health information laws. They amended HIPAA to make it far more stringent. In other words, make the penalties a lot greater. There was a pretty good argument that you, as an employee, might not have to face the HIPAA criminal penalties. Because as I said earlier, HIPAA applies to plans, providers, clearinghouses, and Medicare prescription drug sponsors. Those are the covered entities that have to comply with HIPAA. But you're an employee or have some other relationship with a covered entity. So there was an argument that employees couldn't be convicted of HIPAA crimes. Now, some of them were, as we'll learn in a minute, but the HITECH Act cleaned up that possible defense of, hey, HIPAA doesn't apply to me, I'm only an employee. And it says that an employee or other individual can commit a HIPAA crime if the health information is maintained by a covered entity and the employee or other individual didn't have authority to do what they did. In other words, they didn't have authority to make that disclosure. So I think even your significant other could be convicted of a HIPAA crime if you, without authority, did something that you shouldn't and disclosed it to your significant other, and they then did something evil, like use it to embarrass someone. Other individuals sounds pretty broad to me. Students, other patients, independent contractors. And then another thing that the HITECH Act did, it expanded the HIPAA civil and criminal liability to business associates of covered entities. Now, a business associate is a person or business that performs a service for the covered entity that involves protected health information. The classic example is a transcription service. An outside transcription service, they obviously have to use protected health information to take the physician's dictation and transcribe it into the health record. So they're the classic example, but there are literally hundreds of possible business associates. Billing services, document destruction services, copy services, literally hundreds of potential business associates, and now they and all their employees face the same civil and criminal penalties as employees and others involved with covered entities. Well, I mentioned a little earlier that we've had some HIPAA criminal convictions already. The first one committed identity theft by using a patient's financial and demographic information to apply for credit cards in that patient's name, which he then ran up. He got 14 months in federal prison. The second conviction, Ms. Ramirez, she came up with the brilliant plan of, I'm going to sell copies of the charts of our FBI agent patients to drug dealers. Well, who did Ms. Ramirez pick out to sell for $500 copies of the FBI agent's charts? An undercover FBI informant. The FBI took a dim view of this particular crime. But because she only got $500 in marked bills that were recovered fairly quickly, and Gibson had run up $9,000 in his credit card identity theft, she did a little better in jail time than Gibson. She only got 6 months, followed by 4 months home confinement. I guess she was fashion conscious. She wanted to wear that new accessory, the ankle bracelet, that some others have popularized. Machado and Farrar worked in patient accounts in a Florida hospital, and they committed identity theft. Machado pled guilty and only got 6 months home confinement and 3 years probation as a reward for testifying against Farrar, who has the dubious distinction of the only person pleading not guilty to date and getting convicted by a jury. Since he didn't have a plea bargain like Gibson, Ramirez, and Machado, he got 87 months in federal prison. Howell, Meckenstock, and Stevenson all worked at a clinic in Oklahoma City, and they again committed identity theft. Howell simply gave the data to the other two, and they did the identity theft. So he only got 14 months. Meckenstock got 119 months, and Stevenson, get this, got 168 months in federal prison for misusing patient data. Now the next one was Ms. Smith, and she worked for a doctor in Arkansas. And she simply leaked data to her husband. And her husband then called up the patient and said he was going to use this data against the patient in some legal proceeding that was going on. Now maybe it was a custody battle and he was going to leak that the person was getting some mental health treatment to try to make it difficult for them to get custody. We don't know. But that obviously is an improper disclosure. We've got some more. Miami Palmetto Hospital had an actual ring, identity theft ring, and a medical records employee got 2 years, and the accomplice got 11 months. And then finally, a doctor and 2 hospital employees in Arkansas simply accessed the chart of a patient who died in the hospital out of curiosity. It was a real notorious murder case, and they just wanted to see what the medical conditions were that resulted in the death out of curiosity. So just for accessing the chart when they had no clinical or administrative or business need to, they now have a federal conviction. They only got probation, 2 years probation and community service. They avoided jail, but they now have a federal conviction for life, and the physician can be denied any federal funds. Well, what other than a criminal conviction could result? Well, if you violate HIPAA, you could be terminated on the spot. If you know that someone else in your organization violated HIPAA, you must report it. And if you don't report it, you could be terminated. If you have a professional license, like a doctor does, or a nurse, or lots of different types of therapists, and you violate HIPAA, you could get fired and lose your license or have other professional discipline. Your employer could be fined and maybe even be criminally liable if the employer wasn't HIPAA compliant and that lack of compliance helped a member of your workforce commit the crime. So how do you avoid these legal and employment hassles? Well, it's really not hard. Keep your mouth shut. Observe the need to know rule. If a person doesn't need the information for the performance of their duties, you don't disclose it to them. It's just that simple. Use and disclose protected health information only as permitted by the law and your employer's policies. And if in doubt, ask. If you're not sure that you can make this disclosure, ask. Ask your supervisor. Find out. Other ways of avoiding these legal and employment hassles, follow the policies. That's what they're there for. It's to help you do this right. Pay attention during HIPAA training. Take action when you detect or suspect a breach. Report the situation to your superior, to the security officer, or other proper official. And just use your good common sense. 90% of HIPAA compliance is just common sense. Be discreet and keep your mouth shut. Your spouse, significant other, parents, brothers and sisters, friends, and others have no business knowing that a named individual is a patient or client or anything about the patient or client's situation. Co-workers don't even need to know anything about a patient that is unnecessary to know in order to be able to perform their duties. Be discreet and keep your mouth shut. You may want to tell the funny story that happened at work today that involved a patient or client. It's better not to at all. Better just to keep your mouth shut. But if you do, for God's sakes, don't use the patient or client's name or disclose anything that might identify the patient. For example, if the patient is a celebrity and you say anything about, like, we have a well-known patient and guess what happened to her, that's as good as saying the name. Observe the need to know rule. Do not get hold of, read, or access a paper or electronic record unless you are A, authorized to do so, and B, have a proper reason to do so, such as to provide proper and appropriate care, such as to bill for the service, such as to help get insurance benefits approved. Again, I'm being pretty redundant here, saying the same thing over and over, but that's because it's important and we want you to get this right. Observe the need to know rule. Curiosity killed the cat and could cost you your job, your freedom, and your money. Use common sense. If you're not sure that you have a need to know, then you probably don't, but at a minimum, you want to check with your supervisor and find out. You want to use and disclose only as permitted by the law and by company policy. Your employer's policy should tell you exactly what uses and disclosures are proper, and if you're not sure, if you're in doubt, ask. So to recap how to avoid these hassles, use and disclose only as permitted by law and company policy. Follow the policies religiously. When in doubt, ask. And again, use your good common sense. Now I want to talk about the HIPAA security rule a little bit. Your supervisors may have been doing a lot of HIPAA compliance to get the security measures in place to protect the data. Not only does HIPAA have a privacy rule which tells when and how you can use and disclose the data, it has a security rule giving guidance on how to protect it. You know, nothing in HIPAA requires your organization to have an electronic health record. The HITECH Act wants to ultimately require them, but HIPAA doesn't absolutely require you to have any automation. But if you do, you've got to follow the security rule, which has standards for the security of individual health information for all your data that is stored in a data repository or transmitted over any network. Now, HIPAA defines this very broadly. A data repository is more than a hard drive. It is any electronic media. And transmitted over any network includes physically moving media from one port to another. Now, so-called transfers by sneakerware do not fall under the computer definition of a network. That requires things like modems and the like. But HIPAA's definition means if you physically move a floppy disk or flash memory or a CD from one drive to another, that is a network transmission that the security rule covers. The privacy rule applies to all protected health information, regardless of form or format. So the privacy rule covers paper records and oral communications. The security rule, however, only applies to protected health information maintained or transmitted in electronic format. There's 4 categories of security requirements: the general rules, administrative safeguards, physical safeguards, and technical safeguards. Each of these categories has standards that must be followed. And most standards have implementation specifications, either required ones that your organization must do, or addressable ones that they have to sit down and figure out whether they need to do them or not. The general provisions of the security rule require your organization to ensure confidentiality, integrity, and availability of electronic protected health information, known by the acronym of EPHI. Protect against reasonably anticipated threats or hazards to the security or integrity of EPHI. You don't have to protect against an absolutely impossible risk. Rather, you have to figure out what risks could reasonably occur. For example, I'm located right now in Kansas. I kind of have to think about what happens if a tornado hits and the power goes out. Do I have good enough backup to withstand a tornado knocking the power out? Protect against reasonably anticipated uses or disclosures that are not permitted by the privacy rule. Ensure compliance by the workforce. You're all probably members of the workforce, but the workforce includes more than just employees. It can include volunteers, students, independent contractors that are working on site. And the security rule applies to all EPHI regardless of form or format, and both internal and external communications. Your organization cannot avoid the security rule by saying we only have an intranet. We don't go out on the internet. Pure intranet is just as regulated by the security rule as an internet transmission. Now, a lot of people have complained to me that the security rule's too vague. Doesn't really tell us exactly what to do. Well, that's a good thing, because if they told you exactly what to do, everybody would have to have the same top-of-the-line security that a celebrity mental health clinic has to have. And maybe a podiatry clinic doesn't need that level of security. So HIPAA builds in flexibility of approach, and that's in section 164.306B of the security rule. By the way, you will not be tested on your ability to remember that legal citation. And that section, however, says that covered entities may use any security measures that allow them to reasonably and appropriately implement the standards and implementation specifications of the rule. And in so doing, you get to consider how big your organization is, how complex it is, capabilities you have, what's your technical infrastructure. You get to consider cost. This risk analysis that your organization has to go through is defined as the process of selecting reasonable, cost-effective security measures by balancing the cost of the security measure against the cost of the harm that would result if that security measure wasn't in place. And you get to consider the probability, how likely is the risk to happen, and the criticality of potential risks. Criticality refers to how harmful will it be. So you're going to take and apply your presumably limited security budget to the risks that are likely to happen and going to be very harmful if they do happen. Section 164.308 lists the administrative safeguards. I'm not going to read down this list that's in your book because we're going to talk about them. The security management process requires your organization to implement policies and procedures to prevent breaches, to detect them when they occur, to contain them, don't let them get any worse, and to correct them. It requires risk analysis. That process I just talked about of selecting reasonable, cost-effective security measures by balancing the cost of the security measure against the cost of the harm that would occur if that security measure wasn't put in place. Risk management is nothing more than then actually implementing the security measures that your risk analysis told you that you need. If your risk analysis, for example, tells you that your firewalls are 2 years out of date and you need new ones, risk management is going out and acquiring them and installing them. Sanction policy is required as we continue the security management process implementation specifications. It's nothing more than a statement of progressive discipline that your employer must have and apply when a member of the workforce commits a breach. It can start out fairly light with just a verbal warning or a written reprimand, but it must include termination for a serious breach and, in an appropriate case, referral to law enforcement and professional licensure or disciplinary authorities. Information System Activity Review is just a fancy name for audit. Your organization must audit you for compliance. They must audit chart access, see who accessed that celebrity's chart, and then did they have a proper need to. And if they didn't, then that sanction policy is going to get pulled out. A number of workers at UCLA Medical Center just got fired for improperly accessing Britney Spears' chart, and Farrah Fawcett's chart, and Governor Schwarzenegger's wife's chart, for no good reason other than curiosity. One of them is facing charges because she tried to sell copies of Britney's chart to the National Enquirer. She's pled guilty but has not yet been sentenced. But I will say this for UCLA Medical Center: they had good information system activity review because they caught those people. And so management isn't getting hassled. Management isn't getting criminally indicted. Got to have a security officer. It's called assigned security responsibility. You need to find out who's your security officer. That's the person who's responsible for development and implementation of the policies and procedures that the security rule requires. The next standard is called workforce security. It wants policies and procedures to ensure that those of you who need access have it, and those who don't need access don't have it. So you need to consider policies and procedures for authorizing access and for supervising that access. And then there is a clearance procedure. Many times what your employer does to clear new employees as part of the hiring process is good enough. But you have to take a look at it. Such things as criminal background checks, credit checks, verifying education, verifying references are what we're talking about here. Information access management continued. Policies and procedures for authorizing access. These are usually fairly simple things. Like your policy may say no person may be granted access until they have completed required HIPAA training. Security awareness and training is why we're here today. your organization must train all members of the workforce, including management, in both initial and periodic refresher training, in such things as how do you properly log on, what antiviral protection is there, how are passwords managed, and the like. Security incident reporting is very important and has taken on additional importance with the HITECH Act. Remember, earlier on in this class, I suggested that one of the ways to keep yourself out of trouble is to take action when you detect or suspect a breach. That ties right in to this requirement of the security rule, security incident reporting. Policies and procedures to address security incidents. Got to have a response procedure and a report procedure. The report procedure requires you to report not only actual breaches of confidentiality and data integrity, but also breaches of policies and procedures that didn't result in any actual harm, because the next time it might result in actual harm. For example, if your supervisor notices that you forgot to log off when your policy says must log off when you leave the workstation, and they notice it 5 seconds after you walked away from the workstation, and no unauthorized person saw what was on the screen, there was no breach of confidentiality. But there was a breach of the policy protecting confidentiality that says you must log off. Now, in my opinion, if you've been a good employee, that shouldn't result in much more in the way of sanctions than a verbal warning or maybe a written reprimand. Shouldn't get fired for that unless you continually keep doing it. If I was your supervisor and that happened, I'd say, listen, you forgot to log off. Our policy is you must log off. I'm giving you a verbal warning. Next time I catch you not logging off, I'm going to get serious. Now, the security incident response procedure talks about how do you handle the breach. And the first thing is to contain it. Don't let it get any worse. For example, if you learn that a coworker is committing identity theft and you report it, I submit that management should immediately suspend their access pending investigation so they can't commit any more identity theft. Let's contain the breach. Don't let it get any bigger. HIPAA calls that mitigation. We want to mitigate the harm. In other words, lessen the harm. Don't let it get any worse. Another aspect of mitigation is taking steps to keep it from happening again, which may include taking disciplinary action if the breach occurred as a result of an employee not following policies. I tell you guys, you've just got to report security violations. However your report procedure says. Most organizations want the report to go to the immediate supervisor. If you can't find the immediate supervisor, you go to the security officer. The HITECH Act now requires reporting in certain circumstances to the Department of Health and Human Services, and in certain circumstances to the victim of the breach. Now, you don't want to take off and do that yourself. You don't want to be calling up Health and Human Services and reporting a breach, because maybe that's not the kind of breach that should be reported, and then you're exposing your organization and maybe even yourself to all this liability we've talked about. So management needs to figure out whether to report the breach to the victim of the breach or to the Department of Health and Human Services, but that puts another layer of seriousness into handling these breaches properly. Before the HITECH Act, the maximum civil fine was $100 for a breach. Now, under the HITECH Act, the maximum fine is $50,000 a breach if the breach is not corrected properly. So that means handling these breaches is crucial now. And let's say you lost one of these, some type of flash memory with 50 patients' charts on it. Health and Human Services views each chart as a breach. So multiply 50 charts by $50,000. And that's not going to help your Christmas bonus. Contingency plans are required. And guys, is this rocket science? Do you need HIPAA to tell you you need to back up your data? Do you need HIPAA to tell you got to have disaster plans for if the power goes out? Continuing with contingency plans, emergency mode operation plans. For example, if you're at a hospital or a long-term care facility and the power goes out and the backup generator fails, who distributes the tablets and pens to take paper notes during the power outage, and then who collects those notes and makes sure they're properly integrated into the electronic health record when the power comes back on? Those are the kind of things we're talking about. Testing and revision. If I had a backup generator, I wouldn't want to learn that the gas had degraded and you can't fire it up during the power outage. I'd want to periodically test it. Evaluation. You know, HIPAA's not like Y2K. Your organization got Y2K compliant and pretty much forgot about it. Who here in the audience has thought about Y2K lately? But HIPAA, you got to stay compliant. The risks are going to change. The technology is going to change daily. Your patient mix is going to change. The services you provide are going to change. So you've got to do a periodic, and they don't say how often, you figure out how often periodic is, review of your security and see is it still good enough. I usually suggest at least an annual review of your security measures to see if they're still good enough. Business associate contracts and other arrangements. As I said earlier, the HITECH Act makes business associates face the same civil and criminal liability as do covered entities. And the covered entity is going to be liable for a business associate's breach unless they have a contract in place with them that sort of shifts the liability down to the business associate. So you got to get these business associate contracts in place. Physical safeguards, there's only 4 of them. Access controls, workstation use, workstation security, and device and media controls. Access controls, this is how do we physically limit access. We already talked in our administrative procedures about how do we administratively do it. Who decides who gets what access. Well, now that we've given that access, this is how do we physically keep an unauthorized person from being able to sit down at the workstation, where they might, if they have learned a password, be able to log on. Well, if they can't get to the workstation and sit down at it, we're going to avoid that breach. How do we prevent an unauthorized person from seeing what's on the screen? As by locating the workstation where it cannot be viewed by passerby. That's all we're talking about here in this standard. Workstation use is a policy that tells you how to behave at the workstation. This is where it's going to tell you if you have to log off, if there's going to be an automatic log off after a predetermined period of time, or is a screensaver good enough? These are in these policies, like the workstation use policy. Workstation security, again, this is how do you locate the workstation so it cannot be accessed? How do you locate the screen? Device and media controls. Here we're trying now to have some control over our equipment and media as they float around the facility. Under this standard, I have, for example, written flash memory policies, portable computer policies, cell phone policies, because all of these things can be used to store and transmit electronic protected health information. So under the device and media control standards, we've got to implement some control over how these things float around. How do you properly dispose of electronic health information? There is a big lawsuit going on where a plastic surgeon threw out his hard drive on the trash heap. And he swore that he wiped it before he threw it out. Well, you know what the person who scarfed it up off the trash heap recovered from it? The before and after pictures with patient identification of his breast reductions and augmentations. These women are not happy, and they sued. So you got to make sure that you dispose of your electronic protected health information in a manner that protects confidentiality. And your security officer will be involved in that and know how to do it. Technical safeguards are really pretty simple, and they're pretty vague. HIPAA's almost technologically neutral. When we talk about access control, how do we control access? HIPAA doesn't care whether it's user ID and password, user ID and retinal scan, thumbprint reader, some other technology. They don't care. Just some way to technically control your access, to limit access to people who need the access. Getting back to our need to know rule. Audit controls, nothing more than how do we technically do that audit that we decided we needed to do back under our information system activity review standard under our administrative safeguards. And again, HIPAA doesn't care how it's done, just some way of auditing. Integrity refers to you cannot overwrite data or delete it improperly. You know how we correct the paper medical record? Draw the line through it, leaving it still legible, write in the correction and date and sign it. We got to do the computer version of that. Typically by flagging the incorrect entry as an error and generating a new field with the correction. But we can't just delete it. The only time we can destroy electronic protected health information is when the retention period has expired and it's destroyed properly in connection with a destruction policy. Person or entity authentication, some combination of user ID and other tool like a password or a retinal scan, we can identify who accessed the chart, who manipulated the data, or who transmitted the data to somebody else. And then transmission security means making sure that the data cannot be modified or destroyed while it is in transmission. For example, encrypting it will do that. If it's encrypted, it cannot be modified during transmission. Well, those are the security rules. So what do you have to do to comply? Well, again, at the risk of sounding like a broken record, follow your employer's policies. Keep alert for security risks and problems, and if you notice one, tell your supervisor or the security officer. Again, follow the policies. Take corrective action if you see a breach. One of my clients had a minor breach, and I want to tell you how well that member of the workforce handled it. They have a destruction company that backs a truck up to their loading dock, and they load the paper records to be shredded. And as the truck drives around, the drum spins and shreds the records. Well, this member of the workforce walked out on the loading dock about a minute after that truck pulled away and saw a piece of paper there on the loading dock that should have gone into the shredder. He immediately scarfed it up and got a team together to fan out from the loading dock to make sure that no other documents fell out and got blown across the street by the wind. And think how good that immediate action was. They didn't find any others, and no harm has resulted from this breach, so there must not have been any others. But think if another one had blown across the street and he didn't take it on himself to take that corrective action immediately. I mean, that was just using good common sense. Again, on purpose, I'm repeating it the third time on this slide, follow the policies. Pay attention during HIPAA training, both the initial and periodic refresher. You have to attend it. Your employer must keep attendance records of exactly who attends HIPAA training for 6 years and has to be prepared to show them to the federal government whenever the federal government wants to see them. The Department of Health and Human Services is auditing covered entities for HIPAA compliance. And one of the things they always ask to see is the training records, because that demonstrates that that organization is committed to HIPAA compliance if they are actually training their people. Learning what HIPAA requires, paying attention during training, is the best way for you to avoid these hassles we've talked about, these criminal employment penalties. Well, you know, we've been talking about taking action when you notice or suspect a breach. I'd just like to talk a little bit more about what a breach is. A breach means that someone discloses or blabs health information to someone who's not supposed to know it. And you know, disclosure can occur in a lot of ways. Talking, emailing, faxing, copying, leaving a file out where somebody else can read it, letting someone log in with your password and take a peek at the electronic data and so forth. But then, as I said earlier, a breach is also a failure to follow your organization's policies, whether an actual harm, like breach of confidentiality, results or not. So again, take this action when you detect or suspect a breach, either of actual confidentiality or of policies. Let's say your policy requires employees to log off when they go to lunch. And you see a computer with the data up on the screen and nobody there, and you know it's lunchtime. You've got to do something about it. You have to report it even though you are absolutely sure that nobody saw what was on that screen. Yeah, there wasn't a breach of confidentiality, but there was a breach of the policy requiring log off. So you should take the action of turning off the monitor and then reporting it. If you're at a party and you hear employees talking about a patient or a client, you got to step in and tell them to stop and to report it. Take corrective action. Now, we all have been brought up to, we don't like to snitch. We don't like to tattletale. And you probably don't want to be a snitch or have your coworkers think of you as a tattletale. But think about it this way. You might, by taking corrective action, prevent the serious breach that would get somebody fired. You may save their job by telling them to shut up and then reporting them. Then maybe it's only going to be a 3-day suspension, where if it goes on and that patient hears about it, it's going to be termination and maybe even criminal prosecution. Take corrective action. If you fail to take it and fail to report a breach, you are violating HIPAA yourself. And that could get you fired. And just in case you're wondering, HIPAA has whistleblower protection. You cannot be fired if you snitch, even on a superior that's committing a HIPAA violation, if you have a good reason to think that that supervisor is violating HIPAA. Now, if you do it in bad faith, it's not true, then you could be severely disciplined. But if you have a good faith belief that somebody above you is committing a HIPAA violation, then you can report it without fear of reprisal. You got to know how to report. HIPAA requires your organization to have a report official, a person to whom you can report violations. Quite often it's the security officer, but it doesn't have to be. Your organization will figure out who's the best person to report to. In addition, anyone, you or your patients or other organizations, can complain directly to the Department of Health and Human Services about a HIPAA violation. I'm back to use good common sense. You can usually avoid all of these hassles by your own innate common sense. You know whether you've got a legitimate need to do what you're doing or not. You know whether you should talk to the patient or about the patient or client with the people you're talking to. And again, when in doubt, ask. So, in conclusion, HIPAA has big criminal and employment penalties for violations. You can avoid them if you keep health information secret, don't blab, or otherwise improperly disclose. Use your good common sense, keep your mouth shut, remember the need to know principle. Is there a legitimate clinical, or medical would be another way of saying it, administrative, I got to access the chart to change the patient's phone number so we can contact them, or financial need to do this. Report and take corrective action on breaches. That is, report people who are breaching the policies or confidentiality. Make them stop. Take immediate corrective action. In conclusion, I really hope that this guidance we've beat you about the head and shoulders with helps you be better able to help your patients or clients by properly using their health information and avoid these legal and employment hassles. Are there any questions?
Yes. Has any doctor or nurse ever been convicted of a crime?
The question is, have any doctors or nurses been convicted of a crime? And I assume you mean the HIPAA crime. Because doctors have been convicted of Medicare fraud, and other crimes. But we just recently, less than a month before the filming of this training video, had the first doctor convicted. And all he did was, out of curiosity, access a chart when he didn't have a medical reason to do so. It wasn't his patient. It was another doctor's patient. So he just wanted to satisfy his curiosity, and he now has a federal conviction. Good question. Any others?
How much worse does the HIPAA Act make it now?
Well, I think it makes it considerably worse. The question was, does the HIPAA Act make HIPAA compliance worse and the penalties worse? Well, it clarified and did away with the defense, hey, you can't convict me, I'm not a covered entity, I'm only an employee. Did away with that defense totally. And it expanded that liability to business associates and their workforce. So that's maybe 10 times as many people face the HIPAA crimes as before the HIPAA Act. A hospital quite often will have over 100 different business associates. And now all of them face these civil and criminal penalties, and the civil penalties have gone up from a maximum of $100 per violation to a maximum of $50,000 per violation. Requires this reporting, the HIPAA Act does, of breaches to Health and Human Services. So if your organization has a large breach involving what's known as unprotected health information, in other words, it's readable, it's not encrypted, it's got to be reported to Health and Human Services. So then they're going to come down and fine the organization. As a lawyer, I see a self-incrimination issue here. You're having to report your breaches to the party that could decide to criminally prosecute you or impose these heavy civil penalties. And the HIPAA Act requires Health and Human Services to audit not only covered entities, but business associates. So I think that just really changes the playing field and makes HIPAA compliance a lot more serious. Any other questions?
Well, how much have the criminal fines gone up after HIPAA?
The criminal fines haven't gone up after HIPAA. They remain a maximum of $250,000, which I think doesn't need to go up much to get my attention. Because that's, again, per violation. You know, you do identity theft with 10 different patients' charts, you face $250,000 times 10 and 10 years imprisonment times 10. Now, under the federal sentencing guidelines, you probably wouldn't get that, but you're going to get a bigger hunk than you want. Other questions?
Do business associates need HIPAA training?
Good question. The question was, do business associates need HIPAA training? Yes, the HIPAA Act requires them to, by law, follow the security rule. Security rule, as we talked about, requires training. So business associates need the very training that we've gone through here today and could face penalties if they don't do it. The HIPAA Act doesn't add business associates to the list of covered entities, but it might as well have. It says they face the same civil and criminal penalties. They have to be audited. They have to follow the security rule, and they can only use and disclose in accordance with the privacy rule. So how are they not effectively covered entities, even though they weren't added to the list of covered entities? They got to do everything a covered entity does. Well, if there are no other questions, I would like to thank you all for your attention and wish you the best of luck with HIPAA compliance. Thank you.